enjoy this beautiful country, its most valuable resource, its people, are threatened by an enemy within: AIDS. The national HIV prevalence is 5%, with regional variation ranging from 2 to 14%, females being more affected than males. One organization has been in the forefront of fighting this deadly enemy, bringing hope to Tanzania: the Benjamin Mkapa AIDS Foundation. Join us as we embark on this journey through hope.
Towards the end of the century, in the years of the 1990s, the seriousness of the problem of AIDS and its impact on our society became very manifest indeed, and that government had a role to play in combating this disease.
Human resources for health is a big challenge here in our country. Right now we have a shortage of 62% of the basic health workforce that we need.
The Benjamin William Mkapa HIV/AIDS Foundation was established in April 2006, and the establishment of the foundation was superseded by an establishment of our first program, Mkapa Fellows Program. The Mkapa Fellows Program was our first program, which was also established by the former President of the United Republic of Tanzania, Benjamin William Mkapa, in collaboration with the former President of the United States, President Bill Clinton. Basically, our foundation has been aiming at complementing and supplementing the government efforts in the fight against HIV/AIDS. And our programs have been more of innovative kind of programs that try and find solutions or quick solutions, but also at the same time strengthening their systems in improving HIV/AIDS service delivery. So the Mkapa Fellows Program, through the funding support from Norway government, was able to recruit the 99 fellows, health professionals, and we've been seeing tremendous improvement in the service delivery in those respective districts. But basically they've been working closely with the existing health workers in those districts and under the supervision of the district medical officer. From the good stories or the successes which we've noted from Mkapa Fellows, the Ministry of Health and Social Welfare also requested us to provide technical support for another project called Emergency Hiring Project. This is another project which is funded by Global Fund, and it also aims in accelerating HIV/AIDS services in rural districts of Tanzania. We also have another program which we initiated almost a year ago, which is looking on strengthening maternal newborn health services. And this program, we've tried to link it in integrating it in HIV/AIDS services as well. And we've utilized the existing health professionals in the district that we deployed to strengthen the emergency obstetric care of health centers.
Because the hard-to-reach districts in the country were not very attractive to health workers, we had to devise a program that would not only recruit, allocate them to the rural areas, but make sure or facilitate their continued stay rather than their absconding back into the urban areas. And so that is how we thought of the Fellows Program.
Our journey starts from Simanjiro district in Arusha region, a region which has been missing a regional doctor for such a long time.
Welcome to my home. I used to make chapati to earn a living, but I can't do it anymore. I had chest pains.
I was afraid if she died, I would stay alone and suffer.
I started having chest pains in 2005. The doctors found out it was TB. All that came to my mind was that I will die and leave my son alone. That was all I could think of for about 3 years. At that time, the only person who could take care of me was my mother. My son was taken away by my family members. They took all my clothes and my belongings and distributed them among themselves. They also sold my farm as well. This radio only works at night. I was born here and also went to school here. I have 2 kids. A month after I gave birth to my second child, I felt very sick. I went to the hospital and they gave me medication, but I didn't get any better. So I had to test for HIV. The result came out positive. When my daughter got sick, I also asked for her to be tested, and she also tested positive. At that time, I wanted to commit suicide. When I look at my sick child and look back at myself and my mother being very old, I have 3 children and the oldest has a stroke. She also has HIV. She can't fetch water. She can't do any domestic duty apart from cooking and washing her own clothes. That's all. Honestly, I have suffered a lot, especially after their father's death in 2002. I'm also sick. I've spent 2 years in bed. I cannot give any help to my sick children.
We asked the district AIDS control coordinator, how many AIDS patients do you have?
He had a few patients, probably less than 10. So we decided, let's begin with those who are available. Let us find out where they live. So we got ourselves together and looked for them. Before, AIDS patients were told to begin taking the ARVs while they still had enough CD4 count, just because they had been admitted in for a long period of time. But since Dr. Okio arrived, things have changed. The CD4 machine is available now, and if you have any problem, you look for Dr. Okio and he's available to help despite any duties.
Clients' turn-up was huge. I remember the first day we enrolled 30 clients, and it has been rising. To date, we have more than 100 clients.
In the past, the doctors were not that responsive to patients. They had given up on me and saw me as a waste of time, and that I wouldn't survive to see the next day. That's what they are thinking.
She was among the first clients
who were very sick with AIDS. And there was too much stigma among the society around her and the staff at the hospital. So conveying the message that there was an HIV client was very difficult among the staff because of the stigma.
Now our health have improved a lot from the services offered by the Mkapa Foundation. The medication and the food that I'm taking helps a lot. I do not have a husband, so this has made my life better. Even my little daughter, although she is infected, but due to the medication we're getting from the hospital, we have hope.
Now we're heading to Newala district in Twara region, where the Mkapa Institute has improved the service of providing antiretroviral drugs that are issued by the Tanzanian government under the Ministry of Health and Social Affairs.
So the program of Mkapa Fellows, once established, it recruited 99 fellows and they were deployed to 33 districts of Tanzania.
This is a warehouse where we are keeping all the medicine. And this is my colleague who's taking some of the equipment for HIV tests in the laboratory. When we came here, the whole system of giving out medication to patients was not efficient, but the knowledge we got from the Mkapa's foundation helped us to improve things. Apart from facilitating better provision of these services, the Mkapa Institute also has a number of strategies that are aimed at creating awareness and education on HIV/AIDS to youth.
With me are the members of Newala Youth Network in collaboration with Mkapa Fellows. My name is Martini Lawi Likeleko, Vice Chairperson for Newala Youth Network. My name is Helfan Nuru. I am a member of Newala Youth Network. When Mkapa Fellows arrived here in Newala in 2006, they asked a few youths to meet them. We were about 3 of us. They told us Mkapa Fellows' activities and that there was a need to form a youth alliance that would help fight against HIV/AIDS in our society.
Now we're heading to Kilosa district in Morogoro region. The Mkapa Institute, in collaboration with the Ministry of Health and Social Welfare, is exercising the Emergency Hiring Project Order. I work as a first-grade nurse at Magubike Medical Center in Kilosa. The center had water problems as well as electricity and many others. I also discovered that some patients were not treated the way they were supposed to, and I had to teach them how to do an injection safely and properly, and work regulations as well. Our journey continues to Mufindi in Iringa district. The Ministry of Health has managed to coordinate the provision of HIV/AIDS health services in the country by distributing the regions amongst different stakeholders in the fight against HIV so that they can cooperate with city councils to assist and improve HIV/AIDS healthcare services.
By that time, my wife was pregnant, and at last we got one. It had no electricity, water. It had none of the most important social services, and it was not finished. Urambo is a remote area. The road network is very poor, and the health facilities are far and hard to reach. Urambo has about 25,000 square kilometers, that is almost twice Kilimanjaro region. When we arrived, we found a team of about 6 staff who were attending the clients, and the district had only one care and treatment center, which was the district hospital. So what we did was to facilitate the care and treatment center so we could offer better services and more working days a week. When we arrived, the situation wasn't that good. Despite that, there were a few clients, less than 600 compared to date, when we have about 2,000 clients. Also, this region has poor means of transportation. One would rent a bicycle and travel for 6 hours to reach a destination, sleep, and from there catch a bus the next day and start a journey here, where she would arrive here in the evening and will have to come to the care and treatment center the next morning. After the clinic, she will have to spend a night here in Urambo and begin her journey back home the following day. This was torture to our clients. We decided to start an outreach program. This way, we managed to reduce the congestion to this care and treatment. Benjamin Mkapa AIDS Foundation has helped me a lot. By working in this environment, I have as a doctor realized the needs of my clients. We have a saying that the best book is your patient. I have serviced clients with different health issues, and as a young medical doctor, I have experienced and learnt a lot from my clients. In the field of servicing HIV/AIDS clients, the Benjamin Mkapa AIDS Foundation has helped me a lot.
You can see that this was a very small venture to supplement the greater efforts of the government to deal with this serious threat to the viable growth of our society. I really do believe that although we have made some progress, far more than some of the neighboring countries, for instance. But we still have a long way to go. And we can hit better targets if we lend our hands in cooperation from the private sector, from the general public, and from the government upscaling its work against this terrible disease. I believe it can be done. As Mwalimu would say, it can be done. Play your part.
Center.